Sizabakwira Aphrodis, a resident of Kamembe sector, is the head of the family of 7. They all tested positive for COVID-19 as part of the contact tracing for his wife, Mrebwayire Chantal, who had contracted the virus the previous day and was put in an isolation center. Save for one child, the rest of the family was positive, and health professionals advised them that they would receive home-based care. Sizabakwira believes that receiving health care in a non-healthcare setting is among the reasons they managed to defeat COVID-19.
tujya kumenya ko twarwaye coronavirus umudamu yagiye mu isoko.
We contracted the virus after my wife had returned from the market, where she came into contact with a porter who had tested positive the previous day for coronavirus and had been taken to a quarantine center. After, my wife went for testing and results came back positive. The entire family tested. My results and those of the 5 children were positive. My wife was taken to the treatment center, but they could not take all of us. They advised us on prevention guidelines to follow under home-based care. We are all safe now and have recovered. 21 days later, following strict prevention guidelines, family members who are receiving home-based care in self-isolation recovered. It was a relief to the mother of the family, who was in a treatment center, to know that her family members remained home and safe. After hearing the entire family had tested positive, I was very worried about the safety of our home. But I was happy when I got to know that they received treatment from home. I was sure that the father would take care of the children, and he did exactly that, making sure that everyone followed COVID-19 prevention guidelines. It went well. Nyiraneza Shakira is another COVID-19 patient who received home-based care. She shared her experience. I stayed home going about my usual work and taking care of myself without worrying so much as it would have been if I was in a healthcare setup. 2 weeks after constant follow-up from health professionals, I recovered. In Rwanda, patients with COVID-19 who undergo home-based care are required to follow strict prevention guidelines, including self-isolation, wearing face masks at all times, and social distancing, among other hygiene practices. They are regularly tested and temperatures recorded while receiving treatment for all the symptoms presented. Dr. Menelas Nyeshimana from Rwanda Biomedical Center said that the government recently considered home-based care for patients with COVID-19 who present with mild symptoms. The program is currently being tested in the border district of Rusizi, with the plan of rolling it out in other parts of the country. He explains the rationale being followed.
Patients
receiving home-based care do not lose on anything compared to those in treatment centers. However, everyone is not eligible to receive home-based care. We follow a certain criteria. This includes the mindset of the patient and their understanding of the virus, their family setup, do they have clean water and electricity, the size of the family, among other details, to ensure the safety of the surrounding community. The trial phase of home-based care has seen 22 people recover from COVID-19 out of the 50 patients receiving health care in a non-healthcare setting in Rusizi district. Rusizi has so far registered over 640 COVID-19 cases in total, almost a third of the national tally, while 90 people have so far recovered. Reporting for RwandaTV News, Athan Tashobya.